Hi, I just wanted to document the cost and how a pregnancy journey has been for me as a note to myself as well. Currently, I am in actually 14 weeks mark, and roughly until now, I've spent maybe just over $400-500. This might not apply to everyone. So I have Medicare, but I don't have any private healthcare. And this is me just going through a public system. So at week 5, I realized that I was pregnant while I was on a long 2-month holiday. So I went to my overseas gynecologist to get tested, and I was pregnant in the test. So I also had an ultrasound on the same day at the same gynecologist. I'm not going to mention the cost for this scans and tests during my holiday because it doesn't apply to Australia and the costs will be different. At about week 11, I came back to Melbourne and I went to my local GP straight away to get everything sorted. They wanted to take a scan and a blood test. And I had already done a scan at week 10 and a blood test, a very holistic blood test. However, the results were in a foreign language, and the public hospital that I was in a catchment for would have required an English blood test result and a ultrasound report. Again, I didn't have a report because that country I was in a holiday at didn't provide any report. It was just a printout of the ultrasound. So basically I had to redo the whole blood test, urine test, and ultrasound. Now, the GP told me at that first appointment at week 10 or 11, that I have basically two options. Either I take the NIPT test, which tests for the gender as well as the Down syndrome, and a few other things, I think. Another option was do a combination of the blood test and ultrasound to measure the hormone levels of some sort, again to see if there's a chance that the baby would have a Down syndrome or not. But the GP explained to me that this is less accurate than the NIPT test. They also explained that not everyone goes with NIPT test because it's very expensive, a couple of $100, at least in my area, and that the other option, the combination of the ultrasound and the blood test to see the hormone levels, were a bit more affordable, which everyone basically did. That's how the GP explained it to me. I forgot to mention here that my GP told me I had to get one or the two done to get referred to the hospital. So I went with the latter option, not the NIPT, but with the ultrasound and the blood test and the urine test. So the ultrasound was meant to be taken at week 12 or 13. The urine test and the blood test, I think, had to be done within a week of that ultrasound. So at week 12, I pretty much went straight after that GP appointment to the to book in for the ultrasound, and they said that week 12 is actually a little bit too early. They prefer it, they can see it better if it's at week 13. And so I booked in the ultrasound for week 13, and I did the blood test pretty much a few days after that GP appointment, around week, I think at the beginning of week 12 or so, as well as the urine test. And the cost for each of the tests, so the urine test and the blood test was out of pocket, maybe $135. Some of them were covered by Medicare, some of them were not. And the ultrasound was about $185 out of pocket. So 135 plus 185, and then at around week 13, the GP told me that they were going to send the results to a pathology, VCGS, for maternal serum screening and pre-eclampsia test. So I'm guessing this is the test that where they see the hormone levels, whatnot. I'm not 100% sure. And that was I think that's going to be another 135. So I'm not sure if this applies to everyone and if the Medicare rebate is the same for everyone, but roughly we're speaking $400, $500 for my first trimester. Now I am at roughly week 14 and have entered my second trimester, and I'm going to try to document the overall cost along the pregnancy journey at different stages. But so far for the first trimester, going through a GP with Medicare, and deciding to go with the public hospital system, I've spent about $400 to $500. Now, one thing to bear in mind, my GP didn't tell me about this, and I found out on the day of the test, with the urine test at week 12. You had to have at least had 1 hour after since the last time you went to the bathroom. So my GP didn't tell me this, and I had to kind of wait around for an hour in the pathology because I had just went to the bathroom before I visited the pathologist. And also with the ultrasound at 12 weeks, they prefer 13 weeks rather than 12 weeks because they said that they can see things better. But in my case, it was a bit of a unique situation because what it says on my ultrasound from the holidays overseas, the week numbers on that ultrasound scan was a bit different from the due date that they gave me. So my due date was a week earlier than what it would be if they were to calculate based on the date and size noted on the ultrasound. And there was a bit of confusion between the ultrasound sonographer and my GP. I had to do a bit of investigation with talking to the gynecologist that I saw during the holidays overseas. Basically, the due date, I think it also depends on the country how they calculate the due date as well. But basically the due date that they give you at the beginning is based on a solid 28-day period cycle, and for every average woman who has a 28-day menstrual cycle, it's like a text. If you have a textbook ovulation date and cycle, then that's the date that they gave me initially. But obviously everyone's body is different, and for me, my menstrual cycle is a little bit longer, so there was a bit of a delay, I think, in the ovulation or whatever. And so my actual due date would have been a week later as per the ultrasound. So the baby is a little bit small, whereas the due date on paper initially was calculated based on a 28-day menstrual cycle. And I'm not sure how they set the official due date in that overseas, as opposed to here in Australia, Melbourne. But obviously there was no communication between my overseas obstetrician, gynecologist, and my GP. I had to do a bit of investigation. And that would have been a bit of a problem if I went to the ultrasound, the 12-week ultrasound, earlier, because I was actually at 12 weeks, not 13 weeks, when I went in, when I thought I was already at 13 weeks, based on the due date on the paper. So that is one thing to bear in mind. There's a difference between the date on the ultrasound and the official date that calculated based on a textbook number. And I would have had to do the 12-week scan again and pay the $200 or whatever again had I went in there 1 week early. So I think it's always good to really double check with your GP actual due date, and the size of the baby, and be clear on what week you're actually at. Otherwise, you might have to redo the tests. So yeah,